Hello everyone, welcome back to Thea Talks. I'm Dr. Soumya Aish, ophthalmologist, Director Thea Eye Care Clinic. And today we have Dr. Pranav Ish with us. He's Assistant Professor in Department of Pulmonary and Respiratory Medicine, Safdarjung Hospital, New Delhi. Hello Dr. Pranav, how are you?
I'm fine.
Great. I hope you and your family are safe and healthy at home.
We are recovering from a recent infection. So we are in home isolation and at present healthy.
Okay, we hope for an early recovery. So, are we into a third wave of COVID for sure or not?
At present, according to the statistics, there is definitely a rise in the cases. And it is not only for Delhi. So if you see for all over India, there has been a spurt in cases in the last 1 week or so. And considering that this Omicron is highly infectious, as we come to know from data from South Africa, we will definitely have more cases in the coming days. So most likely, yes, this should be the third wave. But of course, statistics in the further days will tell us more.
Okay. So, coming to Omicron variant, so where was it first discovered and what structural change is there between the Omicron variant and the Delta variant, which was there in the second wave?
So it's very simple. Actually, viruses are prone to mutate, and there are variants which are created because of genetic mutation. So there are certain variants of concern as per the WHO guidelines. Now, Omicron is the latest variant of concern, which was first isolated or detected in South Africa in the month of November 2021. Now, the major change Omicron has is that it has a lot of new mutations. In fact, when the genetic analysis was done, there are over 30 new mutations, and that too in the spike protein area. Now, spike protein or the S protein is the infective part of the virus, which helps us to gain entry, which helps it to replicate. So, this is one of the reasons probably that it has evaded our immune response. Despite our vaccination, despite our previous infections with COVID, we are still getting infected with this variant because it has mutated, so it has adapted to infect us basically.
So, where is Omicron variant genome sequencing done in India, and what are the criteria to get it done? Like, if anyone has a COVID positive report, then how can he get his genome sequencing done?
Personally speaking, any COVID infection has to be treated as a COVID infection, whether it is of Delta variant or Omicron variant. Whether the infection was caused by Omicron variant or Delta variant or the preceding variants is more of an epidemiological concern, because see, if it's an Omicron variant, there are more chances of spread. But in terms of treatment, there is no difference. So first of all, one should not go after trying to get oneself tested as to which variant has caused it. Second of all, as per government guidelines, people who are coming from high-risk countries, their samples are sent for genomic analysis. When you have an exposure to a person coming from these high-risk countries, their samples are also sent. And as a part of epidemiological exercise, certain samples from all labs are also analyzed for Omicron. So recently you must have read in newspapers that in Delhi, the percentage contribution of COVID cases due to Omicron has risen and it has crossed the Delta. So that is on the basis of the various tests that have been conducted. But frankly, it does not affect the treatment, it does not affect the management, and hence one should, if detected as COVID positive, should follow the same treatment guidelines which were given by the government last year as to classifying oneself as mild, moderate, severe. If one has a mild infection, that means has fever, cough, cold, but is maintaining saturation above 94 and not having breathlessness, then home isolation is the best cure.
So, is there any difference between the symptoms that this Omicron variant is causing as compared to the Delta variant in the second wave?
So there have been published literature from South Africa and from other countries also now, including European countries, which say that Omicron may remain more concentrated in the upper respiratory tract, that is the nose and mouth, and the spread to lungs is less. So it is possible that it causes less breathlessness, less fall in saturation, and it may lead to less admissions also. But please remember, this is on a general perspective. If one is having any underlying illness, for example, heart illness, diabetes, hypertension, old age, then it may lead to a moderate or a severe infection. So the best way, of course, is to keep monitoring oneself in terms of temperature, in terms of saturation, and in terms of any breathlessness. But yes, a good and a favorable feature that we have found among published studies is that Omicron tends to cause a milder infection, which recovers faster and generally does not require hospitalization.
Hopefully that is a kind of a good news for everyone, that it causes a mild infection, and with home isolation and proper quarantine, people can get better and they recover only at home, and hospitalization is not required.
Yes, so the most important things in current times is that it is spreading. So we have to get ourselves tested as soon as we have symptoms. And once positive, maintain isolation so that we don't spread it to others. This isolation can easily be done as at home because it's a mild infection. This will allow us to keep the beds in hospitals at least available for those who have moderate or severe infection. So triage, as we call it, is most important, and now in fact can be easily done. In the past 2 years, we have learned a lot about COVID. So we have learned that by simply monitoring our saturation and symptoms, we can do a self triage and we can keep our doctors informed of our symptoms and recover very easily at home, also in home isolation.